The lower limbs or the lower extremities. What are the functions of the lower extremities or lower limbs? But before we go on, we want to examine the structure or the bones of the lower limbs, and then we'll talk about the functions. So first and foremost, the lower limbs divides into three regions. The first region is going to be known as the thigh, the leg, and the foot. The femoral region is going to begin, or the thigh begins at the hip and ends at the knee. The leg begins at the knee and ends at the ankle. And the foot begins at the ankle and ends at the distal end of the digits. And the lower limb is composed of 30 bones all together. You have one femur, one patella of the kneecap, one tibia, one fibula, 7 tarsal, 5 metatarsal, and 14 phalanges. Let's examine the functions of the lower limbs. And the functions are, the first function is to carry the weight of the trunk. If you examine the difference between, so let's do the comparison between the femur versus the humerus. The femur is a lot bigger than the humerus, okay, and a lot thicker than the humerus. The reason why is this is that if you recall what I said, the bone density correlates with the weight bearing capacity. The thicker the bones, the more weight bearing support it provides. And for that reason, we know for a fact the femur is a lot thicker than the humerus, and we know for that reason, we know the femur provides more support than the humerus. Which makes sense. The femur provides the weight or bears the weight of the pelvic girdle and the entire axial skeleton, in addition to the pectoral girdle and in addition to the upper limbs. So all the bones from above will pass the weight down onto the femur. Now, the femur is obviously a long bone. Moving down to the next one is going to be what's called the patella. Patella is a sesamoid bone. It's by far the largest sesamoid bone in the body. So the patella is the kneecap. Now moving down onto the leg, which is composed of the tibia and the fibula. The tibia is more medial as opposed to the fibula, which is more lateral. So fibula is more lateral and tibia is more medial. Now don't confuse on the spelling of the tibia versus fibula. Tibia, T-I-B-I-A. Fibula is F-I-B-U-L-A. On the lab exam, I never ever want to see anyone who spelled fibia, F-I-B-I-A. That's a no-no. There's no such thing as fibia. It should be spelled as tibia, T-I-B-I-A, or fibula, F-I-B-U-L-A. And both of these are long bones. So the question on the exam I would ask you is this, is that the tibia is blank to the fibula, and the answer would be medial. Yes, because the tibia is on the inside as opposed to the fibula. Now the next question is, the tibia is blank to the femur. And the answer should be the tibia is distal to the femur. If you recall, the tibia is moving away from the point of attachment, which is in this case the hip, and the femur is closer to the point of attachment. In this case, it's going to be the hip. So the question was that the tibia is blank to the femur, and the answer would be the tibia is distal to the femur. Okay. Now, moving down onto the tibia, we can find on the tibia what's called tibial tuberosity. It's a little bump that you can feel on you. A little bump that you can feel about. So let's find the tibial tuberosity on you. Okay, beginning at the kneecap. Go about 2 to 3 fingers down, and you can feel a little bump on the proximal end of the tibia, and that is the tibial tuberosity. Now, so what significance does this? Why is this significant or important? Well, the tibial tuberosity is a bone mass that provides a site for the connection of the patellar ligament, which means the patellar ligaments attach to the tibial tuberosity. Now, moving along the ridge along the shaft of the tibia is called the anterior crest of the tibia. So the anterior crest, so the word crest means bridge. So the anterior crest of the tibia is going to be the anterior aspect of the tibia. So you can feel the sharp edges of the anterior crest of the tibia found along the anterior aspect of the shaft of the tibia. Now moving down onto the distal end of the tibia, there should be a little bump on the ankle. So that there are actually 2 bumps on the ankle, one on the medial side and one on the lateral side. Well, the malleolus belongs to the tibia and the fibula. So on the medial side, it's called tibial malleolus. On the lateral side, it's called a fibular, or I should say lateral malleolus. So the official name could be, so there are 2 ways in which you name these malleoli. The first one is called medial malleolus or tibial malleolus, which indicates, well, the first name indicates it's more medial in direction. The second name just indicates it's the same thing, but it indicates the bone to which the malleolus sits on. So the first name is called medial malleolus, or also known as tibial malleolus. On the lateral side is called, so that little bump is going to be known as, it has 2 names, lateral malleolus, which tells you it's on the outside, or it could be known as fibular malleolus, which tells you this bony mass sits on the fibula. So now we're done with the leg. Let's go to the foot. The foot begins from the ankle and ends at the distal end of the digits.